Director-General, NAFDAC, Professor Mojisola Adeyeye. The National Agency for Food and Drug Administration and Control has begun enforcing the ban on the production and sale of alcohol in sachets and PET bottles below 200 milliliters. The Director-General of NAFDAC, Professor Mojisola Adeyeye, disclosed this at a media briefing organized by the agency on Wednesday in Lagos. The news agency of Nigeria reports that NAFDAC had on November 11, 2025, announced plans to enforce a total ban on such products by December 2025, in line with a directive from the Senate. However, enforcement was initially halted after the federal government called for an immediate suspension of all actions and measures related to the proposed ban, pending consultations and a final directive. Adeyeye said the agency has now received a matching order from the Senate to proceed, and enforcement has already commenced. She explained that the ban aims to safeguard public health and protect vulnerable populations, particularly children, adolescents, and young adults, from the harmful use of alcohol. The proliferation of high-alcohol content beverages in sachets and small containers has made such products easily accessible, affordable, and concealable, she said. We already started the enforcement to ban alcohol production in sachets and bottles below 200 milliliters, after we received the order from the Senate. NAFDAC is not against alcohol, but we are against its proliferation in high concentrations in sachets and small bottles to prevent children from having easy access to it, Adeyeye added. She noted that prior to her tenure as NAFDAC boss, sachet alcohol contained between 50 and 90% alcohol, describing it as extremely high. We asked manufacturers to reduce the content to 30%, but they went directly to the ministry to express their displeasure, citing potential loss of jobs and investment. The then Minister of Health gave them a 5-year period, from December 2018 to January 31, 2024, to adjust their business operations, she said. Adeyeye reaffirmed the agency's commitment to safeguarding national health, particularly the safety of vulnerable groups such as children, through its regulatory activities. NAN